I'm Dr. Ruth Collins. I'm a urological surgeon here at the Sound Hospital, and I also work at Concord Hospital. Yeah, so urinary incontinence in women is a very significant problem for more than one reason. Firstly, because it is such a common problem. It's estimated that about 25 to 30% of adult women at some point in their life have a degree of incontinence. The other reason it's significant is because it has such an impact on people's quality of life. So although no one dies from incontinence, it affects your whole lifestyle, what you do physically, how you feel about yourself. It can affect relationships. It can have ramifications into all aspects of general health. So it's a very significant problem. So urinary incontinence, the simplest definition, is an involuntary loss of urine. So it's basically urine coming out when you don't want it to. The only time urine should normally come out is when we're comfortably sitting on the toilet. So if you have urine coming out at any other time, that's incontinence. And there's more than one type of incontinence. A lot of patients that come and see me think it's one problem, one fix, but it's a little bit more complex than that. You can have problems primarily with the pelvic floor, where the problem is stress incontinence. So if you lose the support of the urethra, usually after pregnancy and childbirth, and then typically you have incontinence when you cough, sneeze, or do physical activity. But there's another type of incontinence which is related to the bladder muscle function. Most people are very aware of their pelvic floor, but are very unaware that the bladder is also a muscle. The reason we don't really understand that is because it's not a voluntary muscle. It's like our heart muscle. We don't directly with our brain think how to control that. So there's a type of incontinence called urge incontinence or overactive bladder, which is when our bladder muscles are not working properly. And that can also cause significant problems. And the reason we differentiate between the two types is because the treatment is completely different. And it's important to tailor the treatment to the type of incontinence that that person has. Some people have both types as well, which makes it a bit more challenging. So the best way of deciding what type of incontinence a lady has is to take a good history. So they can usually describe what triggers the problem, the circumstances in which it happens. And there's very specific symptoms. Obviously, some women can have a mixture of symptoms. And for the majority of women, treatment can be started without the need for extensive investigation. Taking a good history, doing some basic urine tests and imaging, and normally you're then in a position to start treatment. And primary treatment for both urge and stress incontinence is non-surgical. So the primary treatment for stress incontinence is to do some pelvic floor physiotherapy to strengthen up the pelvic floor. Whereas for urge incontinence, overactive bladder training, again that can be done with a pelvic floor physiotherapist, or medications. There's a lot of very good medications that are used as first-line treatment for urge incontinence. And with non-surgical treatment, approximately 2/3 of ladies will be happy with their bladder control. And it's only if they're not improved with non-surgical treatments that you would then go on to do more detailed investigations, usually with a test called urodynamics, in order to look at what that person's surgical options are.